Cadaveric dissection is a cornerstone of medical education. It allows students to explore the human body in a way that textbooks and lectures cannot replicate. Through dissection, students gain a profound understanding of the intricate relationships between different anatomical structures. This hands-on experience is invaluable for developing the skills and knowledge required for a career in medicine. Dissecting a human cadaver is a privilege. It is an act of immense respect for those who donated their bodies to science. Through careful dissection, students gain a deep appreciation for the complexity and beauty of the human form. This experience fosters a sense of humility and responsibility that will stay with them throughout their medical careers. The use of cadavers in medical education dates back centuries. It has played a pivotal role in advancing our understanding of human anatomy and physiology. Today, cadaveric dissection remains an essential component of medical curricula worldwide. It is a testament to the enduring power of hands-on learning in the medical field. The skull, a complex structure protecting the brain, is of particular interest to anatomy students. Dissecting the skull is a meticulous process, typically starting with an incision along the scalp. The skin and underlying tissues are carefully reflected to reveal the bony structure of the cranium. Next, the skull cap is removed to expose the brain. This is done with great care to preserve the delicate structures within. Students then have the opportunity to study the cranial nerves, blood vessels, and membranes that surround the brain. The mandible, or lower jaw, is then disarticulated from the skull. This allows for examination of the temporomandibular joint, a complex structure responsible for chewing and speaking. Students can also study the muscles of mastication, which are responsible for the movement of the jaw. During dissection, students encounter key anatomical features of the skull. These include the sutures, which are immovable joints that connect the bones of the skull. The coronal suture, for example, joins the frontal bone to the two parietal bones. The skull also features numerous foramina, which are openings that allow for the passage of nerves and blood vessels. One notable example is the foramen magnum, located at the base of the skull. This large opening provides a passage for the spinal cord to connect to the brain. The interior of the skull reveals the cranial cavity, which houses and protects the brain. Students can examine the impressions left by the brain on the inner surface of the skull, providing insights into the relationship between structure and function. Cadaveric dissection is irreplaceable in anatomical education. It allows students to appreciate the three-dimensional nature of the human body, something that cannot be fully grasped from textbooks or models. The act of dissection itself is a powerful learning tool. It requires students to develop fine motor skills, hand-eye coordination, and spatial reasoning abilities. These skills are essential for performing surgical procedures and other medical interventions. Moreover, dissection fosters a deeper understanding of anatomical variations. No two human bodies are exactly alike. By dissecting multiple cadavers, students gain an appreciation for the diversity of human anatomy. In conclusion, cadaveric dissection, particularly of the skull, provides an unparalleled opportunity for anatomy students to delve into the complexities of the human body. It fosters a profound respect for the human form and lays a strong foundation for a successful medical career.